Good morning.
Hi,
We're
Dr.
here
Jen.
with Kim. We are at our first post-operative appointment evaluating for removal of number 6 HyProCure stent and replacement with a number 5 HyProCure stent. We have good arch control, stabilization of the rear foot to forefoot. Despite the going down in one side of the HyProCure, she has good range of motion. She has less tension and pressure that she has felt through her arch when she has been up and on it as a result of the decrease in the stent size. She still has the stabilization of the ankle that we have with the tightrope, and then we've also had the gastroc resection, and then she's also had a stabilization of her proximal talofibular joint.
Oh yeah,
This is where the gastroc resection
oh,
was
yeah.
performed endoscopically.
That Dr. Jen, tears of joy. I mean, that is a miraculous surgery. What can I tell you? It's miraculous. I mean, it
definitely has increased your range of motion of the ankle.
Well, yeah. I mean, who knows if I could have been this way for my life or years or whatever. And the biomechanics of having tight gastroc, lack of dorsiflexion, and 4 millimeters of true anatomical bony length difference in my leg, gotten that all in order now, and I'm walking like better than I've walked in over 13 years of my life. It's a debt of gratitude. What can I say? Just thank you for believing in me and I in you, and it's been worth 2 years of coming over here from Idaho to Seattle, or say across the wire to Bremerton, just to be able to have these surgeries and step by step, piece by piece, you and I have worked well together and been able to analyze and deal with every piece of this foot. And the amazingest thing is when I look down at my leg, and you can see it. I mean, I don't know. I mean, I can remember myself 2 years ago, because it's 2 years. Well, what we're at? Yeah, just about 2 years and a few more days that I came here, and I lived with a hard, spastic peroneal anterior, shin. I lived for years where massage therapists would go to try to touch me right through here, and I would just scream in burning pain. And that is entirely gone. Entirely gone. There's something to say about biomechanics, right? You're the trained
Absolutely.
expert. I am just trying to read. I've read everything I could about this leg to find the help that I need. And there's a fine line. The peroneals have to be in balance with the posterior tibial tendon. Are they not the mechanism that controls the arch? If the arch is way over here, the peroneals are getting stretched. This could be
Pronation and supination have to be balanced.
Yeah, they have to be balanced. If you're way over here, the peroneals get highly pulled, and you can get shortened up, and I was probably very, very shortened up in here. Or just the opposite, people that are excessively pronating, inward on their feet, which is more common in a lot of cases. Is that true, Dr. Gent? The pronation in on your feet? Then they're overly stretched on their PTT tendon, and hence all the arch problems, the dropping of the arch, and then they're shortened up out here. So if somebody is having the HyProCure stent put in their foot because they're really flat-footed to try to get their arch up and prevent the further damage of this PTT tendon, then it's very normal that when they start to walk on their foot, that they're going to hurt on the outside, right? Have you seen that with some of your other patients?
That is correct.
Yeah, because it's what has to be. You can't change the arch without thinking you're not going to affect the leg muscles, because it all goes hand in hand. So, well, we've lived through this, and thank you again, Dr. Gent, for giving your expertise and surgical skill and redoing this, and I look forward to seeing you over the next few weeks as we get strong here and enjoying the new walk that I'm supposed to have.
Good. Make sure you do the physical therapy and protecting it, stretching it out, working it so that it's able to get back as quickly as possible to its full functionality.
I will do exactly what you tell me to do. Thank you.
Gotcha.